in teaching of low-stress veterinary care. This is the blending of our low-stress veterinary handling techniques from Dr. Sophia Yin, fear-free techniques from the fear-free program, and the cat-friendly practice techniques from the cat-friendly practice management program. And I'm certified in these various programs. I'm also a certified animal behavioral consultant. So you can find out more about me at my website, drsallyjfoot.com, and this Facebook Live will also be uploaded on my YouTube channel, which is under Dr. Sally J. Foot, and so you can see it later on, and just get lots of handouts and see how I provide in-clinic staff training. I have on-demand education, as well as training here at the Bella Behavior Learning Center. This is my veterinary model center. Well, today's topic is tips on using toweling for helping to hold our cats and use this hands-off handling techniques, especially for blood draws. So it's a few tips on how to use these techniques the best way, and actually also choosing which technique to use for the cat who's in front of you, because not all cats like the bundling and tight wrapping, that is with the full typical techniques that are outlined so well in Dr. Sophia Yin's book, The Low Stress Handling, Restraint, and Behavior Modification of Dogs and Cats, and there's also a DVD in it. Okay, well, let's go over the protocol for whenever we are going to examine a cat, and this is also true for our clients at home. We want our clients at home to always follow these steps if they ever need to put eye drops in, ear drops in, or medicate their cat. Okay, so we're going to have a towel, always have a towel down on the table, and that towel is sprayed with Feel Away. Okay, this is the Feline Classic. That's the only one that doesn't spray right now, but the facial pheromone helps the cat to feel like, oh, I've been on that towel before, I know it. And always remember that you spray yourself as well. So I'm going to give myself a little spray too, because we got Mr. Bob in there, and we're going to be handling Mr. Bob. Okay, so just a few reminders. So the typical toweling, the burrito wrap, if you will, is you're going to have your fingers like a scissor behind the cat's head and neck, coming down over the body. We come up over the head, keep your arm down, no gaposis. Remember, I cover this in my top 5 low stress handling techniques of cats, my on-demand course. You're going to fold these over, and when we're going to do these full wraps, you come at 45 degrees to come over snugly. Okay? Now let's say if you have a cat who goes, and he doesn't like it, how do we change? Okay, that cat told us he doesn't like his head covered. And how do we know? This is the Feline Ladder of Aggression handout. Please download this from my website, drsallyjfoot.com. Go under the veterinary free resources. You'll find a button. Download this, print it off, give it to your clients, paste it on the wall, because when that cat backed up and he meowed, he was hunching his body down, putting his head down. He was showing, I don't like having my head covered. Okay, so that's the trigger. So I have to immediately think, I got to stop that, and I need to change it. Otherwise, if I keep trying to do it and I keep wrapping him tighter, I'm pushing him up this ladder of aggression where they struggle and they hate the towel. Okay, so those are some of the tips. Always have this handout. What just happened? If the cat is resisting it, stop what you're doing and change the approach based on what that cat just reacted to, so that you can strip away that trigger. Okay? Okay, so now, say we have a cat who says, I don't want my head covered, and even as you started to wrap, he started to agitate also. Another tip is we can quickly go to what I call the shroud technique. So the shroud technique is, if you stop what you're doing within 2 seconds of the cat starting to struggle, the cat will de-escalate. They'll calm down within 6 to 8 seconds, about 3 to 4 times longer than how long they escalated up. So that's why it's so important to stop what you're doing and get the trigger away, because that's how the cat will calm down quickly and you can stay on schedule. Okay, so cats calm down. Well, we want to cover those front legs. We don't want to scruff them. So here's the shroud technique. Take the 2 edges, come right up underneath the head and neck, and this is where your chip clip comes into place to only clip the towel. You can clip the towel, and now we have the front leg shrouded, and this is very good for handling, like to do a jugular blood draw. You can put your 2 arms here in position, and we can do a jugular blood draw. We hold the towel here. This is similar to the hold for scruffing without scruffing. So this is how you use your towel to give yourself that anchor point similar to scruffing without scruffing. So we eliminate the hand pinch, and the front of the towel here is helping to prevent the cat from jumping forward. So use this technique a lot, okay? Especially if it might be just a quick procedure or the cat seems to be agitated about being wrapped. Now I'm going to get one last technique. I want to show you one other tip, and then we'll get Bob out and actually show you on a live cat, right, Bob? Okay. So let's say we've wrapped around the cat, or we need to put in an IV catheter. So this wrap's like, well, now his leg's covered. How are we going to do this? And we don't, all this touching and movement may be agitating for the cat. It's very true in our old cats. Our old cats that may have arthritis, they may be dehydrated because of kidney failure, hyperthyroidism, irritable bowel syndrome, malabsorption syndrome of the gut. That's very common in our older cats. Well, how am I going to cover his head because he's hissing or he's pulling his head down and there's a risk for bite? Well, we could still have the forearm out to get, say, an IV catheter placed. But wrapping him in a towel is going to be difficult, or we don't want to have him totally towel wrapped because we have to get to that leg. Okay, so here's another tip. So this is not going to be so good. All right, we can take, he can stay on the towel because we want to protect him from that stainless steel. Cats hate stainless steel. This is where we could take, this is just a regular kitchen towel, okay? Grab a couple of these, have them at your office. Your clients will have these at home. You need to do anything with the front paws. And we can now take, I'm showing you my stuffed cat because then I'll show you in Bob. But have like the bottom edge right about at the back of the neck. So you're going to come up and over the head, underneath and around the head and around. Okay, so you see that? Then I hold I have the two ends held together. You see that? So now this is around his neck. Now I'm not tight, I'm not choking him, but now you see I've got this shroud and I can even hold that. Okay, so it's like a sack over his head. Now, I can take my chip clip, that's why these are so handy, and I clip together those two edges underneath the towel. So now your assistant can hold the cat or just hold the cat, and now we can get in the IV catheter. And when we do a hold off for the IV catheter, do not use your thumb like this. You're squishing on the elbow joint. Many of our older cats have arthritis in the elbow joint. This increases the pain, and then they're going to resist more. Take your finger and just hook it over like so, and your thumb is going to be higher up behind the elbow. I'll show you on Bob when he gets out here so you can extend the leg. And the person who's putting in the IV catheter, do not put your hand below the level of the carpus. You have to keep hold your hand at the point above the carpus to the elbow, not down on the paw. They hate paw handling. So this is how you can then we can hold off for cephalic blood draw, put in an IV catheter. And then if we did need to position on the side, we can hold the towel. We are not scruffing the cat. And now we can rotate the body. So we could do a lateral saphenous blood draw this way. If we wanted to do a jugular blood draw, we could elevate the head in the same way and still do a jugular blood draw this way, okay?